Now, I'm certainly not a proponent of people with ADHD taking drugs recreationally. That's not what this is about. But if you look at their drug-seeking behavior and you couple that drug-seeking behavior to their desire to remedy their attention deficit, you start gaining some really interesting insight into how dopamine is regulating these circuits in normal circumstances and in people with ADHD. So what exactly is going on with the dopamine system in people with ADHD? And what's going on with the dopamine system in people that have terrific levels of attention for any task? Well, in the year 2015, an important paper came out. The first author is Spencer, and it came out in a journal called Biological Psychiatry. And it formalized the so-called low dopamine hypothesis of ADHD. The idea that dopamine was somehow involved or not at the appropriate levels in people with ADHD had been around for a pretty long time. But a formal proposition of the low dopamine hypothesis led to some really important experiments and understanding of what goes wrong in ADHD. It turns out that if dopamine levels are too low in particular circuits in the brain, that it leads to unnecessary firing of neurons in the brain that are unrelated to the task that one is trying to do and that is unrelated to the information that one is trying to focus on. So if you think back before, you've got this default mode network and a task-related network, and they need to be in this kind of concert of anti-correlation, and in ADHD, they're firing together. Well, the problem seems to be that when dopamine is low, certain neurons are firing when they shouldn't be. This is like a band, right? We'll go back to our band. That's a guitar, a bass, and a person playing the drums. And it's as if one of those or several of those instruments are playing notes when they shouldn't be playing. Right? The pauses in music are just as important as the actual playing of notes. When dopamine is too low, neurons fire more than they should in these networks that govern attention. This is the so-called low dopamine hypothesis. And if you start looking anecdotally at what people with ADHD have done for decades, not just recently since the low dopamine hypothesis has been proposed, but what they were doing in the 1950s and in the 1940s and the 1960s, what you find is that they tend to use recreational drugs or they tend to indulge in non-drug stimulants.